Thank you everyone for joining in and tuning in today. My name is Gunner Edgell. I'm a third year student here at MSU CVM. I'm originally from West Virginia. I ended up coming here due to the contract seats program set up between West Virginia and Mississippi. I was fortunate enough to land one of the seats for that. And I also was really interested in the program because of their well-known 2-and-2 program, where they do the 2 years of lecture and 2 years of clinical training. I thought that would suit my learning style the best because I'm very hands-on. I think I have a shorter attention span than most people. So 3 years of lecture and only 1 year of clinics wouldn't have been best for me. So I think coming here and getting these an extra year of clinical rotation really sets me up for the best success. So yeah, I'm really grateful to be able to come to this school. This is Dr. Morgan. Dr. Morgan on the other side. He also has a DVM and owns a PhD in veterinary pathobiology. He is one of the clinical professors in the pathobiology department here at Mississippi State University. He teaches on the clinic floor and in the classroom. During your first year, he will help out with the pathophysiology course, and he also helps out on the clinic floor and runs the laboratory rotation for third and fourth years. And yeah, he works doing gross necropsy and histopathology reporting. So yeah, busy guy, but he's taking some time today to discuss his thoughts on the school, the rotation, student interaction, and just answer some questions I thought would be good for incoming students and students that are interested in veterinary medicine and how they can kind of get the foot in the door and possibly come here to MSU CVM. So yeah, I will turn it over to Dr. Morgan.
All right, well, thank you for that introduction, Gunner. I appreciate it. As Gunner said, my name is Dr. Morgan. I'm a pathologist here at Mississippi State University. I did my veterinary school, graduated from veterinary school at the University of Missouri, Columbia, quite a long time ago. Shortly after I graduated, or actually immediately after I graduated from vet school, I bought a small animal practice in Colorado Springs, which I ran for about 4 years, and realized that my passion was not in small animal practice, and started looking at some of the options that were available in veterinary medicine. Luckily, veterinary medicine, I think, has one of the most flexible degrees possible. There's so much stuff that you can do in veterinary medicine. And one of the things that when I started evaluating what I liked about veterinary medicine, I realized that what I really like is diagnosing things. And as a pathologist, that's what we do, is diagnose. Don't have to mess with the treatment as much. And it's more of a diagnostic approach to things. So I sold my small animal practice, and I went back to school and did a pathology residency and did a PhD in pathology at Iowa State. Following that, I got my first job as a professor at LSU at the School of Veterinary Medicine down in Baton Rouge. I was there for about 7 or 8 years before seeing the light and coming to Mississippi State University in 2010. And I have been a faculty member here at Mississippi State University since 2010. So that's kind of a little bit of my background on how I ended up here at Mississippi State University.
You actually have a really fun and interesting idea for how to go about the rest of this conversation. If you want to talk about that a little bit.
Yeah, sure. So one of the things that I enjoy doing in my spare time, I'm very much into virtual reality and VR gaming. So one of the things that I think we're going to try to do on this interview, since I think probably everybody in the world plus their dog is kind of tired of Zoom meetings and WebEx at this point after the last couple of years, we're going to be picking up this interview and this conversation in VR, and we're going to be playing some miniature golf and just discussing some of the things that we're going to be discussing, and Gunner's going to be kind of interviewing me on the golf course while we're going to be playing some miniature golf. We haven't decided exactly which course. We may be on a space station, or we may be in a jungle, or we may be in a labyrinth. I'm not sure exactly where we're going to be, but it should be fun. So we're very much looking forward to that. So I guess we'll be seeing you guys on the course.
So we're playing mini golf here.
Playing some golf.
Yeah, we're going to do a mini golf interview here. So we'll just be talking while we're playing mini golf. I think my label says Big Tim. I'm Dr. Morgan, and then this is Gunner. And then we've got someone else named Ian here who's doing our recording for us. So we'll go ahead and get started. And Gunner, if you got questions, we'll go ahead and start asking those.
Yeah, so I know it's a long road just through vet school and to get to vet school, but it's even longer road like where you're at now, being a pathologist, a boarded pathologist. So if you wanted to just talk about that pathway and like what it took to get there, and like the certification process and all that.
Yeah, okay, sounds good. Well, what we do to become a pathologist, it's a 3-year residency program that can be done. You have to have your DVM first, so that's done after vet school, and we do the 3-year residency that can be done before an internship or after an internship or after you've been in practice. All of those things are possibilities for doing the residency program. About probably half of the people who do pathology residencies also do PhDs, either concurrently or following their residency training. Then following residency training, the certification process involves taking a board exam, which unfortunately is not a very easy or fun exam to take, but that's what it takes to become board certified. So the exam's actually broken into 2 parts now. The first part is general pathology, which can be taken at the end of the first year of your residency. And then the second part is the second portion of the exam includes gross pathology and histopathology and all that kind of stuff. Have you ever played mini golf before?
I have. I think it's the VR.
Okay.
Speaking on the internship and all of that, it's way different than most other specialties. Or a little different in terms of like it's like a 3-year externship instead of like a rotating internship and then another 3 years on top of that.
Yeah, so you can do a pathology residency right out of vet school, and a lot of people do that. You can also do an internship, but again, it's not required for you to do that. And the other thing that is that's notable on that is that the residencies are not part of the match. So it's something where you are directly interviewed by the program that you're interested in, and then they may or may not offer you a position. So it's done outside of the match.
Would you recommend for those students that like don't know if they want to go into like pathology to do that internship and then just kind of figure things out and then try to go? Or... Yeah,
I think that that if you're not certain about what you want to do, an internship is always a really good idea. That kind of helps you figure out exactly what the options are, try different things, see what you like or what you don't like. Nice shot. see what you like or what you don't like about the different aspects of veterinary medicine. I think one of the cool things about veterinary medicine is just how incredibly flexible it is. There are so many different things that you can do as a veterinarian. That, the opportunities are basically endless. So I think that doing an internship is a really good idea. I think one of the things I love about our school is with the 2+2 program, you get a lot of chances to do externships. So you don't necessarily have to wait until after you graduate and do an internship to try to see what you like. If people are considering pathology or something as a career, then it's actually pretty easy for them to do externships. We actually had a student from a couple of years ago who's a pathology resident now, who did externships at 7 or 8 different places that he was considering doing a pathology residency at. So he was able to try out all those different places and see which places he liked and which places he didn't before he applied for the program. He got offers from a lot of different schools.
So with the 2-2 program that we have here, do you think do most other vet schools get like a pathology type rotation with like necropsy and stuff like that? Are you aware of that?
Yeah, I think that most other schools do have a pathology rotation. I think that's one of the required things. But I think one of the things I like about our program is that with our pathology rotation, again, if pathology is something you're interested in, you can come back and do an advanced rotation. You get a chance to do externships at other schools to check out other pathology programs. I think that our pathology program, we also get to do some pretty unique stuff, like experience marine animals. So we work with sea turtles and with dolphins during our pathology rotation. So you get a chance to do necropsies on those animals, which is a pretty unique experience among vet schools. There's not a whole lot of them where all of the students get an opportunity to do that. So that's one of the things that's pretty cool.
Yeah, and that's one thing about pathology. I feel like a lot of people don't know how many interesting and different animals you guys get to work with. But you do. I'm sure you've seen a lot of different things come through the necropsy floor. So I don't know if you want to comment on like one of your favorite cases of like of a rare animal that a lot of people don't get to do necropsies on.
So yeah, we've had the opportunity to do a lot of different animals. I've necropsied bears and lions and tigers and giraffes and elephants and rhinoceroses and things like that, in addition to marine animals. I think one of my favorite necropsy cases is one that I did in 2019. There was a really wet summer in the Midwest, which led to a lot of flooding along the Mississippi and opening of the Bonnie Carey Spillway, and the salinity in the Gulf of Mexico and the Mississippi Sound dropped precipitously. And that caused a lot of damage to a bunch of different species, but one of the animals that was really severely affected were dolphins. And so I was able to go down there and do some necropsy on dolphins that died from prolonged exposure to water with really low salinity. One of the animals that I did, took some pictures of it before and after and during the necropsy. The animal kind of became the poster child for freshwater exposure and for the importance of our oceans and maintaining the oceans. The image became known worldwide. It's been on the cover of several magazines and it's been written about. I think it had a big impact on people finally starting to understand some of the consequences of what we do to the oceans and how the animals have to deal with that. I think that was one of my favorite cases, just because no one knew a whole lot about freshwater exposure, and we were able to really teach a lot of people about that, and learn a lot about that ourselves. And that opened up the possibility for me to go and work pretty extensively with NOAA on defining freshwater exposure and defining freshwater disease. And that just ended up opening a lot of doors and being a really good case to kind of teach people about things. Dolphins are cool to work with because they're a very charismatic species. Everybody loves dolphins. And so when you see something that's happening to them, I think that motivates people to take care of our oceans in a way that just in pictures of plastic floating around in the water or any other animals that are damaged by human activities, it gives us a lot better chance to sway people and to make them really start caring about some of this stuff, which I think is a really, really important thing. So I think that's probably one of my favorite pieces.
So like if students are interested in doing research, then maybe a pathology is a route.
Pathology is a great route to take if you're interested in research. Pathology kind of bridges the gap between clinical medicine and the basic sciences. And so it's just an excellent thing to do if you're a person who wants to do research. Especially if you want to do clinical research. Most of the people that work in drug companies that are leading the teams that are developing human drugs and everything are veterinary pathologists and toxicologists and people like that. But they're very, very important in working with medical devices and in developing drugs for humans, not just for animals, but humans as well as animals. So yeah, there's a whole lot of research potential for people that are pathologists. A lot of my friends that are pathologists are primary researchers. And so that's an excellent path to go into if you're going into veterinary medicine to become a researcher. Pathology is, I think, an excellent option in this case.
And for me, like one thing I think about, just when I think of like a pathologist and what they do, I tend to think of like working in like an environment, like an institution, like this, like Mississippi State or a school somewhere. But I know there's like specialty centers and everything, but yeah, there's, like, what are some other like maybe places you could end up as a pathologist that most people like don't think about?
Yeah, so I think pathology is super, super flexible. There's a lot of different things that you can do in pathology. A lot of pathologists actually work for the drug companies, like we were mentioning a second ago, Pfizer and Eli Lilly and all the different drug companies. Veterinary pathologists, they're one of the major people that employ veterinary pathologists. People in pathology work in state labs and educational institutions, like you said. A lot of them work for commercial labs, so like IDEX or Antech. Anyone who's worked in a veterinary clinic has probably sent off biopsies, samples to IDEX or Antech. And they employ a lot of pathologists there. A lot of pathologists also work in government. So working in government regulation in NOAA, the National Oceanic and Atmospheric Administration hires pathologists. So they work there and a lot of different places. I have a good friend who I did my pathology training with who works for the Food and Drug Administration, so the FDA.
Nice.
And others work in the Department of Agriculture. So there's a lot of different opportunities and jobs out there. And then again, there's the whole research opportunity. So a lot of pathologists are actually primary researchers, and that's the main thing they do is just research.
So if students are like prospective vet students are interested in some pathology, would they be able to like come shadow anyone here at the vet school, or just kind of working at their local clinic, or what do you recommend?
Yeah, so we do have, we allow students to come in and kind of shadow the pathologist. So you can, students can come in, even before they're veterinarians, they can come in and get some experience hanging around with the pathologists and kind of see what pathologists do, see if that's something that they're interested in. So yeah, that is definitely an opportunity.
So for students that are coming to the lab services rotation and they're going to be working on the necropsy floor, are there things that you think they should expect or be comfortable with or be prepared to learn about? Is there any advice for them, the students?
Yeah, I think that necropsy is something that a lot of students are kind of dread before they come on the service. There's some unpleasant things about it. In the summertime in Mississippi, we do occasionally get cases that are less than pristine on the necropsy floor. So there's some odors and there's some things like that. But it's not. I think by the time students are done and have gone through the service, I think that almost universally they really enjoyed it. That it was a lot of fun. I think that when you come onto the service, you need to be willing to be a team player, because we do things as teams, and you need to be able to be willing to work hard and to help out other people, and to really dig into the cases that we're looking at and look at the information, research the diseases we're looking at, and be willing to stand up and present the cases. It's so interesting to be able to look inside of an animal and put the story together of what's happened to that animal's life and what's led to that animal's death. I think that overcomes the, obviously it's sad to see animals die, and I don't enjoy spending all my time around dead animals. I much prefer the live ones, but there is something to be said about being able to find an answer. A lot of times the owners want to know what happened. The clinicians want to know what went wrong. And everybody wants to know how they may be able to improve things moving forward. So I think there's a lot of really good stuff that comes out of that. And I think as long as students are realizing that and keep that in mind going in, I think that the pathology rotation actually, ends up being a pretty good rotation. I think that the students, you get out of it what you put into it, but I think the vast majority of the students put a lot into the pathology rotation, and as a result, I think they get a lot out of it. So I think it is a very, very valuable rotation.
Yeah, it's good you brought up Friday rounds. I think that's with necropsy. I think that's a part of your rotation that kind of sets you guys apart from a lot of other rotations too, and just like presenting on cases and how the students present to a decent amount of people, usually an underclassmen. But I think it's a really good way of like tie together like a week of the hospital of like what's been happening, anything new, or yeah, it's a great way, especially for me, to really dive into my case I had that week that I'm presenting and really understand the pathology, because come Friday, like you're going to be presenting that and going to have to answer questions and explain what's going on in this animal. So
yeah, one of the things I really like is to watch the confidence level of the students on rotation go up between the first Friday rounds and the last Friday rounds. It's just amazing to see the improvement that's done there, and how much more confident and comfortable they are talking about that stuff. One of the things that I enjoy about necropsy is that you get to look at the whole picture, not just a little tiny part of it. So that's really nice. And I also really enjoy necropsy because I get to work with students. I'm on biopsy. I sometimes have a resident with me, but mostly I'm sitting there by myself. On necropsy, I've got students, and I get to talk to you guys and try to pass on some hopefully important information, and just feel like I'm being able to participate in really honing your diagnostic skills.
if you
Sounds
have
good.
any, if you have any final comments from the rotation or anything else you want to say.
Well, I think for prospective students, I think that one of the most important questions you asked me about, I think, was the 2+2 program. I think that's a very, very important consideration is how much clinic time do you want at a school. And I think that schools with 2+2 programs, you get a lot more time in clinics and you get a lot more time to do a lot of different things that for some people are going to be kind of game changers in how they learn stuff. I think looking at things like that is very, very important when choosing a school. I know one of the other things, this isn't pathology related, but one of the other things that I love about our program is the experience you guys get in some of the other blocks, but specifically in doing surgeries. I know when I graduated from vet school, I had done 2 dog spays and a cat neuter, and that was it for my surgical experience. I had watched a lot of residents do a lot of surgeries, and I had handed a lot of people different surgical tools, and I had washed a lot of instruments, and I had done a lot of stuff like that, but I hadn't done a lot of surgeries. And for you guys, it's not unusual by the time you guys graduate for you to have done 70 or 80 or 100 spays and neuters because of some of the opportunities that are available with the spay neuter bus and all that kind of stuff. And I think those are some pretty amazing things. We hear from clinicians or from people in practice that hire graduates from Mississippi State that the Mississippi State grads hit the ground running a lot better than students from some other schools, and I think a lot of that is because of the amount of time that you guys get in clinics and the amount of time you get to do surgeries and the amount of time that you get to go on externships and to explore those things that either you're very, very interested in or those things that you feel like aren't covered to the extent that you want them to be covered. So you have an opportunity to go get additional training somewhere else. And I think that those are all really, really powerful tools that are given to the students here to allow them to succeed. And I think they succeed very, very well. We get feedback sometimes from the people that take our students in internships that within the first couple of weeks of the internships, the students from Mississippi State have really started to outshine some of the other people in different residencies. That sometimes first couple of weeks in, they're the equivalent of maybe an intern that's been there for 6 months or a year. And again, I think that's because of some of the opportunities that Mississippi State gives their students. Not just in pathology. Obviously, we have an excellent pathology program. I realize not everyone wants to be a pathologist, but I think that there's a lot that the school has to offer. And I think it's I hope that prospective students will really take a close look and reach out and talk to some of the people here and talk to some of the students here and find out all they can about Mississippi State because I do think it's an excellent school. So that's my spiel.
I think it's a good one. I think you answered all my questions. I think your point of view is going to help out a lot of students, whether prospective or current students at Mississippi State CVM. So, I appreciate you taking the time to answer.
No problem.